Hello, everyone. Today we will be talking about elderly healthcare, and we're going to be focusing on the most common diseases, difficulties, and treatment options. Understanding aging. Even though older Americans are living longer and overall healthier, most of them at least have one chronic health condition, and many have multiple health issues. Aging involves gradual physiological changes such as decreased bone density, reduced muscle mass, and cognitive decline. Arthritis, diabetes, and cardiovascular diseases are the most common chronic diseases among older adults. The rising age population is leading to an increase in demand for elderly health care. In the US, publicly funded Medicare and Medicaid are the most popular programs providing health care for the elderly. In recent years, more and more older Americans are choosing to enroll in Medicare Advantage plans as they provide extended benefits tailored to meet specific healthcare needs. The elderly should pay more attention to their physical health, undergo regular checkups, and be examined by a family doctor, dentist, and ophthalmologist. Until now, many elderly face emotional health problems because they cannot be as active as before, and if they migrated to a new country, such as the US, it is more difficult for them to adapt. This may cause more emotional problems. It is also very important to monitor your diet and maintain a healthy lifestyle. As we have already mentioned, it is more difficult for older people to adapt to the new system. Often, the reason may be language barriers, transport, transportation, and so on. People may be intimidated by the fact that medical services are quite expensive in the US, and they often might refuse treatment or services. The healthcare system in the US is quite complex and can be intimidated, but it is quite common for hospitals to have social workers who act as a coordinator of medical services. There are also quite a few different resources and trainings in order to effectively help and support the elderly. Some of the most common health concerns for seniors are arthritis, heart disease, cancer, respiratory diseases, dental issues, and vision problems. Getting older can bring senior health challenges. By being aware of these common chronic conditions, you can take steps to stave off disease as you age. Okay. In general, arthritis refers to a group of conditions that cause swelling and tenderness in one or more joints. The main symptoms include joint pain and stiffness. Although arthritis can discourage you from being active, it's important to work with your doctor to develop a personalized activity plan that, along with other treatment, can help maintain senior health. This is what a fingers of a person with arthritis looks like. As a chronic condition, heart disease affects 37% of men and 26% of women, 65 and older, according to the Federal Interagency Forum on Aging-Related Statistics. As people age, they're increasingly living with risk factors such as high blood pressure and high cholesterol that increases the chances of having a stroke or developing heart disease. These are examples of some of the most common heart diseases. Heart diseases are a significant concern for the elderly, as the risk of developing cardiovascular conditions increases with age. Here are some common heart diseases that affect older adults. Coronary artery disease, known as CAD. This is caused by the buildup of plaque in the coronary arteries, which can lead to chest pain, heart attacks, and other complications. Heart failure. This condition occurs when the heart is unable to pump blood effectively, leading to symptoms like shortness of breath, fatigue, and fluid retention. atrial fibrillation, such as known as AFib. This is an irregular and often rapid heart rate that can lead to blood clots, stroke, heart failure, and other heart-related complications. Valvular heart disease. Problems with one or more of the heart valves can cause issues like stenosis, narrowing of the valve, or regurgitation, leaking of the valve. Hypertension, or high blood pressure. Persistent high blood pressure can damage the arteries and increase the risk of heart disease and stroke. And peripheral artery disease. This is the narrowing or blockage of the vessels that carry blood from the heart to the legs and other parts of the body, leading to pain and mobility issues. Oncological diseases have recently become quite common even in young people, and even more so in the elderly. The CDC also reports that 28% of men and 21% of women over the age of 65 are living with cancer. Many types of cancer are treatable if they are detected in a timely manner during examinations such as mammograms, colonoscopies, and skin checks. And while you can't always prevent cancer, you can improve your quality of life as an older adult living with cancer, including during treatment, working with your medical team, and following the recommendations for healthy older living guidelines. These are some of the most common cancers: lung cancer, non small cell lung cancer, and small cell lung cancer. Risk factors are smoking, exposure to radon gas, asbestos, and other environmental factors. Symptoms are persistent cough, chest pain, shortness of breath, hoarseness, and weight loss. Breast cancer. Risk factors can include aging, family history, genetic mutations, hormone replacement therapy. Symptoms are lump in the breast, changes in breast shape, dimpling of the skin, and nipple discharge. And prostate cancer. Risk factors are age, family history, race, and diet. Symptoms include difficulty urinating, blood in urine, pelvic discomfort, and bone pain. According to the Federal Interagency Forum on Aging Statistics, among people aged 65 and older, approximately 10% of men and 13% of women are living with asthma, and 10% of men and 11% of women are living with chronic bronchitis or emphysema. Although having a chronic respiratory disease increases senior health risks, making you more vulnerable to pneumonia and other infections, getting lung function tests and taking the correct medication or using oxygen as instructed will go a long way toward preserving senior health and your quality of life. So, these are three types of health insurances that you may obtain. You may get Medicaid from the government. So, Medicaid is a government sponsored health insurance program for low income individuals and family. You may get health insurance from work. So, once you start working, you may not be eligible for free coverage for Medicaid or RMI based on your income. Some employers provide with health insurance through employment, so you may use this. But most of the elderly use Medicaid because they no longer are able to work. Or you may buy your own. If you're employed and your employer does not provide health insurance, or you are self-employed, you can purchase a private health insurance plan from Penny Marketplace or through a broker. But again, most elderly do not work, so they either have Medicaid or are able to buy their own plan. Okay. Medicare. Medicare is a federal health insurance program for people aged 65 and older, as well as certain younger individuals with disabilities. Medicare has different parts covering various aspects of healthcare. Part A. Hospital insurance. Hospital insurance covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B. Medical insurance covers certain doctor services, outpatient care, medical supplies, and preventative services. Part C. Medical Medicare Advantage plans, an alternative to original Medicare offered by private companies approved by Medicare. These plans include Part A and Part B coverage and often Part D, prescription drug coverage. Part D, prescription drug coverage, helps cover the cost of prescription drugs. Medicaid and medical assistance. Medicaid is a joint federal and state program that helps with medical costs for some people with limited income and resources. Pennsylvania's Medicaid program, known as Medical Assistance, or MA, provides healthcare coverage to eligible elderly residents. Long-term care. Medicaid covers long-term care services, including nursing home care and home and community-based services, HCBS, for eligible seniors. Medicaid waivers. Pennsylvania offers waivers like the aging waiver, which provides services to help older adults remain in their homes and communities instead of going to a nursing home. So these are some things you have access to through health insurance. Doctor's visits, ambulance, hospitalization, almost all prescription drugs you have access to, vaccinations, tests and examinations, visiting a dentist and dental work, ophthalmologist and optometrics and glasses. So what is SSI? SSI is a supplemental income program for those who are 65 years of age or older, as well as for the disabled. Unfortunately, not every immigration status qualifies for these benefits, but refugees and those who came under the U4U program are eligible. However, we do see a change for those who are arriving after October 1st, 2023. They have difficulties and unfortunately are often refused SSI. We had the opportunity to contact the office, but unfortunately they have not yet received instructions on accepting Ukrainian humanitarian parolees who arrived after October 1st. Okay. Supplemental Security Income is a federal income supplement program in the United States designed to help aged, blind, and disabled individuals who have little or no income. It provides cash to meet basic needs for food, clothing, and shelter. Here are the key aspects of SSI. Eligibility. To qualify for SSI, an individual must meet the following criteria: age, disability, or blindness. So you're either 65 years or older, you are blind, any age with a visual impairment meeting the Social Security Administration definition of blindness, or you are disabled, any age with a disability that meets the SSA's definition of disability. Income includes money earned from work, Social Security benefits, pensions, food, and shelter. The amount of income allowed while still being eligible for SSI is very limited. Resources: things you own, such as cash, bank accounts, real estate, personal property, and vehicles. To qualify, individual resources must not exceed $2,000, and married couples must not exceed $3,000. Residency must be a U.S. citizen or qualified alien, refugees, or parolees. Must reside in one of the 50 states, the District of Columbia, or the Northern Mariana Islands. SSI provides monthly payments to help eligible individuals meet their basic needs. The amount can vary based on several factors, such as federal benefit rate, or known as FBR. This is the base amount set by the federal government. In 2024, the FBR is $943 per month for an individual and $1,415 for a couple. State supplementation. Some states provide additional payments on top of the federal SSI benefit. Living arrangement. The benefit amount may be reduced if the individual lives in someone else's household or receives in-kind support and maintenance, such as free food and shelter. Application process. To apply for SSI, individuals can start online. Start the application process online at the SSA website, or you can do by phone. Call the Social Security Administration at 1-800-772-1213. Or you may visit in person. Visit a local Social Security office. Some key considerations. Medical evidence. Applicants must provide medical evidence to prove disability or blindness. Review process. SSI eligibility is periodically reviewed to ensure continued eligibility and impact on other benefits. Receiving SSI may affect eligibility for other benefits, such as Medicaid, food assistance, and housing assistance. SSI is an essential program for many vulnerable individuals, providing crucial financial support for those who need it most. Living independence for the elderly. The Living Independence for the Elderly waiver gives eligible participants access to home-based services, including personal care, social services, and meals. Applicants must be at least 55 years old and require a nursing facility care level. Each applicant must also demonstrate that they can live safely at home if they receive additional services and support. Call 877-998-5433 to inquire about transitioning to the LIFE program. You can find more information on this website. Okay. Aging Our Way. Aging Our Way, PA, is a 10-year roadmap to meet the needs of the Commonwealth's older adults and improve services for this rapidly growing population. This plan includes priorities, strategies, and tactics to promote health, well-being, and quality of life for all Pennsylvanians as we age. Aging Our Way, PA, also prepares the Commonwealth for a larger, longer living older adult population and is designed to respond to changing needs, shifting priorities, and available resources. The Department of Aging led the charge to develop the plan following an executive order signed by Governor Josh Shapiro in May 2023. For further assistance and resources, please visit the website listed below. In-home care. Most of our people and immigrants in generally rarely use the nursing home program. This is often the last option when a person needs medical supervision 24/7 and children or relatives are unable to provide proper care for their parents, or when a person does not have relatives. Um, in-home care, also known as home care, provides non-medical support in a senior's residence. It includes assistance with activities of daily living and everyday tasks to enable older adults to live safely and comfortably at home. Unlike home and health care, in-home care doesn't include nursing or therapeutic services. A nursing home is a place for people who need 24-hour care but are not sick enough to need hospital care 24/7. Nursing homes provide residential care, personal care, medical care, and various therapies for older people. senior citizens, or disabled people. Nursing homes may also be called care homes, skilled nursing facilities, or long-term care facilities. You can learn more on this website listed here below. So this is it for our elderly healthcare presentation for today. We advise you to please stay healthy, take care of yourself and your loved ones, and if you have any questions, please feel free to give us a call at 215 608 1966. Thank you and have a great day.